Yeah, documents and a screen. Hmm. Got it now. Hello, hello. I hope you are hearing me in this video. So just let me minimize this. Hmm. Okay. So welcome every student of pharmacology. So in this semester, we are learning Advanced Pharmacology 2. That's MPL 201T. Look at the core scope of this Advanced Pharmacology 2. Here, you have to learn a few more units to increase, or you can say strengthen your core concepts of pharmacology. And one more thing here, one more addition is there, that is recent advances which are involved in the clinical applications of a particular disease, and how that drugs we can utilize with the more modification, with more advancement, so that recovery of the patient will become more easy. Major three emphases will be given. One is a mechanism of drug action, how the drugs acts, and what are the cellular and molecular concepts in that. Then involvement of a disease, it's a disease progression and changes in the functional or disease oriented functions, so that we will get a targets, we will get a one core steps, so that we can utilize our medications to make the disease completely free from the pre-form the that complication, and make the person into normal condition. And then how various clinical applications where the particular drug will be utilized. So one picture you can see here. So initially inflammation, when we talk about injury has arisen, so there is a liberation of arachidonic acid, even pain, cox1 cox2 through, or some, so mast cells can release inflammatory mediators, chemoattractants, and they're rolling white blood cells. So leukocytes will migrate and will try to stop the bleeding effects. And again, there is a healing process, regeneration process with natural activities were carried out. But along with, if it is not been there, so we are utilizing the medications in every stage, where the exactly initially bleedings to start, or any cells which are released, and then which are the rolling components are involvement, and finally activate or regeneration process to mediate through. So these are the things. So I kept it on the picture wise and image wise. So understand that whenever you want to learn, or whenever you want to write on a particularly one pharmacological actions of so and so diseases, you must clear that what are the drugs in that category, how they work, and what are their fate. So all will be studied. Now, outcome is what of this learning? Outcome to the objectives initiated. So one should be able to understand how that cellular or molecular mechanism of drug action is working. That means if drug receptor complex will work, how the drug receptor is making the change in the recovery of that case, and also it correlating pathophysiology with the therapy part. So therapy comes with the again kinetic activities or dosing part. So loading dose, maintenance dose, how that will be recover on the initial 1 day therapy, 2 day therapy, and then the diseases are covered or not to be checked. And here during this therapy, it is a very important to evaluate What are the unwanted effects, undesired effects, or you can say some side effects are also making some more worse condition, adverse events due to the toxic dosing or excessive dosing. And then that adverse effects is again helping us to, it is to contraindicated due to any interference or not, and then how it will be recover with the therapeutical uses. So that is a clinical use to be learned. So major three are there: how that work action, correction of the pathophysiology basis, and then pharmacotherapeutic guidelines. So now we will move to the next slide. This slide is representing to you with the study of endocrine pharmacology. So that is your first unit. Endocrine as a name indicates, a study of hormones. And in the study of hormones, how the types of various hormones, and then what are the medications which are involved along with the hormones. Growth hormones, here you can see, if the case of thyroid cases will be there like T3, T4 hormones. If it is a diabetes mellitus is there. So type 1, type 2 diabetes are there. Insulin is a major role here as an endocrine hormone. So it is a controlling the blood sugar level. And during reproductive, when there is a like female reproductions, estrogen, progesterone, or if male testosterones, how the six hormones are related in the overall male characteristics or female characteristics or their reproductive cycles to be maintained. So that is all to be learned in initially, and then that is as a part of agonist. And then if any complications will arise, like infertility will arise, suppose. So how we can treat infertility? So anti process, recovery process, balance process is required. So along with that, drugs to be learned. Like if it is a thyroid excessive, use anti-thyroid. Oral hypoglycemic, type 2 diabetes cases, you must use the oral hypoglycemic to control the blood sugar level. Corticosteroids, excessive growth, you have to stop it. Contraceptives, how at what the level the contraceptives you can utilize. And oral thyroid to parathyroid or vitamin D3, calcium base. So calcium regulators to be used so that all endocrine functions along with the neuro humoral cases we can control it. So basically this is the first unit we are learning in this semester, that is endocrine pharmacology. Total 12 hours are there, but we'll focus more on the antidiabetic, steroids, then con- male and female thyroid, male and female contraceptives and their medications, and then we'll go to the calcium regulator, including vitamin D3 and parathyroid hormone cases. Next, after learning this endocrine pharmacology, next is a, which is a one of the best unit according to me. So that is a chemotherapy. Chemotherapy, basically, many times we come across with the environment. Suddenly we drink unhealthy water, and it is creating some microorganism growth in our body via fever. So fever will increase. We'll go to the doctor and we'll understand what to do. What so we are, paracetamol is given, but basically it is involved with the infection cases. So infection cause detailed pathophysiological change in human body, and diseases once progresses. So start from the changes, like for example, if the sore throat is there, sore throat will enter into the coughing more, then up to TB cases can it is impacted. So their diagnostic also will look into this pharmacotherapeutics, how we can identify the that is a case of a patient and what are the exact medications to be used. But in a chemotherapy, it is a very important to understand the cause of that disease, and what are the medications are required to correct that infectious cases. Because normally if you want to take an example of bacteria, within a second they multiply 10 raised to minus 8 Savoy unit. if we just keep half an hour or 1 hour. So that time the complications are there, and we already taking the microorganism sterile preparations, and we are utilizing against this microorganism. So we have to understand it is directly stopping the growth, or it is inhibiting, or it is directly involved in the killing of that medication. So static to sidal. So bacteriostatic, bactericidal, fungicidal, or fungostatic. So all we are going to learn here. And if it is some antimicrobial therapy, whole recovery. And if antibiotic or specifics are there, bacteria are positive and negative cases, and they will focus more on it. How growth and killing effects can be utilized. So beta-lactam antibiotics are one of the important topics because bacteria are basically interfering in the human life. So their life cycle and human life cycle, we have to correlate and we have to understand what are the cell wall components, cell membrane components, nuclear synthesis. If they are eating us our folic acid, how we can correlate with the ribosomal 30 years or 50 years units if it is aminoglycoside sections. Or genetic material that is with the DNA, gyrase or DNA topoisomerase enzymes for. So how the quinolones will stop the excessive growing infections. And say macrolide antibiotics. Then tetracyclines will be there. So antibiotics categories are initiated here, and then antifungal, antiviral, then anti-TB are there. Anti-tubercular agents. So multi-drug resistance is always a major question here. So two drug therapy, through that therapies, if you are not covering because pulmonary tuberculosis. So it is creating the enteral environment in the lungs in the human beings basically. How the two drug therapy is not able to cover a three drug therapy figure, what will be the conditions. So again, drug resistance will be one big component, and what are the criterias to initiate the initial lower dose of the chemotherapeutic agents to higher dose. So to avoid or to prevent drug resistance mechanisms, or basically drug resistance comes with the R gene. So that R gene, how we can stop it, and what are the ways to cover that R gene, that will be correlated in this learning process. So now advanced chemotherapy is there. Advanced chemotherapy here we have to learn protozoal helminth infections, cancer chemotherapies, immunologies, basically inflammation mediators, also hypersensitivity and immunomodulators. We organ to graft rejections or even liver to liver transplantations. So we are there, or kidney transplantations. So this during transplantation, there is a need of immunosuppressants, and if patient is receiving some any organ of other human person, so we have to understand that immunotolerance will be correlated, and then it's a immunity has to boost in that matter. So immunosuppressant, immunomodulators to be utilized in these advanced chemotherapies, and then we can correlate with their oral chemotherapeutic agents. Asthma and COPD. I think I just it is again correlated with the our respiratory tract medications, and that how anti-asthmatic drugs or inhalers or chronic obstructive pulmonary disease it will be utilized. That we will also see that this chemotherapy. Next unit is there. If you see GIT and chronopharmacology, one is maintain our normal body rhythm. Function is going on in our human body in the normal rhythms. So if suddenly any change will be the rhythm will arise, what is going to work out. So that circadian rhythm to understanding chronopharmacology and how we can correct our normal sleep cycle. Suppose and take an example. The sleep cycle is disturbed. So to what exactly the conditions behind with the rhythmatic levels we can learn and we can provide a therapy. In GIT, you know that ulcers, diarrhea, dysentery, constipation, inflammatory bowel syndrome, this type of infections you already know. and that during UG levels you have learned, and we'll learn some recent advances. Time permits us now. It is very important because semester we hardly get 2 months or 3 months, and within 2 to 3 months we have to finish a lot of things. So emetics, antiemetics, anti-ulcer, anti-diarrhea, and purgative laxatives in a constipation. That is our major learning in this unit 4. Because even osteoarthritis, osteoporosis, or rheumatoid arthritis medication, suppose it is to be treated, there is a very common pain is there. So that will be treated with non-steroidal anti-inflammatories, and that causes mostly gastric irritations, gastric disturbances. Again, sometimes if it is a continuous use, any perforations in the stomach wall will can arise. So we can utilize anti-ulcer medication in that, and it is required also, right? In motion sickness, morning sickness, emesis is very common. So that time nausea vomiting you can avoid with the antiemetics, right? Next, that was the last unit you are going to learn here. That is a free radical pharmacology. So total they have given 12 hours, but we learn understand how many free radicals are there and what are the free radicals creating oxidant to antioxidant disturbances. Your normal SH or normal free radicals, how they are correlating with the number of diseases. One is of cancer-mediated reactions, neurodegeneration related, and diabetes mellitus cases. These three majorly to be focused because this is a major three diseases in India very commonly seen. Alzheimer you can take, well, Parkinson's, free radicals only there. Even type 2 diabetes, if it is antioxidants which is have not been maintained, metabolic disorder it is. So that will be correlated. Even benign tumor or malignant tumor, change in the food cycle, abnormal growth, P53 gene, then tumor necrosis factor involvement. So that all are basically concerned with the radicals, and that radicals will be get to it and use of antioxidant so that they are less released and less impacting to the disease progression. Vitamin C you can take, E, curcumin, and CoQ10. It is an majorly concerned. So all unit 1 to 5 revise and understand. Then so that we can start with our major topic, that is the endocrine pharmacology. So we'll see in that next video. Thank you. Thank you very much. I hope this slide is sharing and you are also seeing that once you get that video. Let me stop now. Okay. We see, meanwhile, I'm putting some questions also, quiz activities. So you can go through it and share with me and give me feedback, right? Okay. Let me end now. End of